A massive vitamin D study has just been published, concluding that in adults with prediabetes, vitamin D was effective in decreasing the risk for developing full-blown type 2 diabetes. This is a big deal because if these findings are true, it will change my clinical practice and recommendations when it comes to vitamin D. So let's go through the paper in detail to see if we can rely on this conclusion. It starts by saying that observational studies provide strong and consistent support for an inverse association between vitamin D blood levels and the risk for type 2 diabetes. So as in, if we've got low levels of vitamin D, that's been correlated with the chance of developing type 2 diabetes. But that's just a correlation. What we need are prospective studies, as in, what happens if you give vitamin D supplements to high-risk individuals? Will those vitamin D supplements reduce the chance of developing full-blown diabetes? And in those prospective studies that have already been done, the risk of developing diabetes was consistently lower in the group that were taking the vitamin D supplements compared to placebo. However, these differences were not statistically significant. In other words, the existing studies that we've got, they show a trend towards improvement, but none of those studies were large enough to definitively conclude that vitamin D supplements reduce the chance of developing diabetes. So in each of the studies, they could see a roughly 10 to 13% decrease in the chance of developing diabetes, but again, that didn't reach statistical significance. They needed larger numbers. This is where a meta-analysis is really useful, so it combines the existing clinical studies that we've got to see if we've got enough numbers when we combine the data together to reach that statistically significant result. The trouble is, the existing meta-analyses that we've got, they included trials that had a relatively short duration, and some of those trials had a high risk of bias, or were not specifically designed and conducted for primary prevention of type 2 diabetes. Essentially, the existing analyses aren't up to standard, which brings us to this new meta-analysis that only included randomized, placebo-controlled studies that were specifically designed and conducted to test whether vitamin D decreases diabetes risk among adults with pre-diabetes. And each of the included studies had to last for at least 2 years, so this gives enough time for the exposure to have an effect and to see whether we will truly see a decrease in the diabetes risks with vitamin D supplements. Each of the included studies were assessed for their quality using the Cochrane Risk of Bias tool. For this analysis, they only wanted to include the very best of the available studies, and the primary outcome that they were looking at was the time to new onset diabetes. Of the 44 studies that they found, only 3 met the eligibility criteria. Again, we only want to include the very best of the available studies. Those 3 studies had a range of different vitamin D dosages, from 20,000 international units per week to 4,000 international units per day, and all 3 trials were assessed as being low risk of bias. From the combination of those 3 studies, we have a total of 4,190 participants that were included in this analysis, and they were split evenly between the vitamin D groups and placebo group. And before the study began, the average vitamin D blood level was 25 nanograms per mil. So before the study began, most of these patients did not have enough vitamin D. So let's have a look at the results. Over a follow-up period of 3 years, the new onset of diabetes, it occurred in 22.7% of the participants in the vitamin D group compared to 25% in the placebo group. And when the authors adjusted for things like age, gender, BMI, and race, they could see a roughly 15% decrease in the chance of developing type 2 diabetes in the vitamin D group compared to placebo. That's an incredible finding. Just by making sure that my patients have got enough vitamin D, I can reduce their chance of developing full-blown type 2 diabetes. But just to give some extra context for those results, the absolute risk reduction for vitamin D compared to placebo was 3.3%, so we're still only seeing a small benefit with vitamin D, but it's important nonetheless, and I would need to treat 30 patients with vitamin D supplements to prevent one of them from developing type 2 diabetes. But here's the really exciting thing. If we only include the patients that had quite low levels of vitamin D to start with, when they were supplemented with vitamin D, there was a much more significant decrease in the chance of developing type 2 diabetes. And for me, that makes these findings a lot more believable because ideally, we should be seeing a dose response, as in, if people have got lower levels of vitamin D, in theory they should have a higher chance of developing type 2 diabetes if we're to believe this hypothesis. And that's exactly what we're seeing here in this analysis, where people with a lower baseline of vitamin D in their blood, they had a greater response to the vitamin D supplements. Now, in clinical medicine, whenever we're considering a therapy for a patient, we need to make sure that the benefits far exceed the risks. So when it comes to safety in this analysis, the frequency of the pre-specified adverse events were low, and there were no significant differences between the vitamin D groups and placebo. Moving to the discussion, this analysis of 3 randomized randomized, double-blind, placebo-controlled trials specifically designed for diabetes prevention found that vitamin D in people with pre-diabetes was beneficial in decreasing the risk for developing full-blown type 2 diabetes, and it increased the likelihood of regression to normal blood sugar levels. And excitingly, there didn't seem to be any downsides with this therapy. Plus, we could see that in people with lower vitamin D blood levels, when they were supplemented with vitamin D, they had a progressively lower risk for developing diabetes. And these results suggest that the blood vitamin D level needed to optimally reduce the diabetes risk may be near and possibly above the range of 50 to 60 nanograms per mil. So clearly a follow-up study is needed to figure out if we should be trying to treat people to a specific vitamin D blood level target. The study does finish with a cautionary note, however. It says that the studied population included people at high risk for type 2 diabetes, so the results do not apply to the general healthy population and should not be extrapolated to those who are at an average risk for type 2, type 1, or other types of diabetes. After reviewing this paper, I am going to change the advice that I give to my pre-diabetic patients that I see in the clinic. Instead of recommending to them about 1,000 international units per day, I'm going to suggest to them to take the tolerable upper intake level of 4,000 international units. Personally though, since I'm not a pre-diabetic, I'm going to stick with my 1,000 international units per day dose. This is in line with the Endocrine Society guidelines. The other supplement that I'm going to continue to take that pairs really nicely with vitamin D is vitamin K2, and I've got a separate video on that here. A massive thank you to DoNotAge.org for their $10,000 donation to my rapamycin study. They are a health research organization, and to benefit from their ingredients as well as a 10% discount code, check out the pinned comment.